Hello, welcome. I'm Anouk van der Avert, one of the consultant paediatric surgeons with an interest in urology here in the Children's Hospital in Brighton. This video was created to give the necessary information and tips to see if we can improve your child's situation. The child was referred to us by the GP for daytime enuresis, which occasionally can go together with nighttime enuresis, and that means it's wetting during the daytime with regular accidents. They can be severe and more mild. It is quite common, and we know that about 1 in 75 children over the age of 5 will have daytime accidents. There are different causes which can be responsible for these problems. Sometimes your child still has an immature bladder, and its capacity is too small to hold the amount of urine that they produce, so they have accidents. In older children, there are other underlying causes responsible for daytime enuresis. There is a group of children who have spinal abnormalities, and this is responsible for their problems, but this group we will not discuss into further detail in this video. In children over 5, who initially were dry and then developed daytime accidents, we often are dealing with what we call bladder instability. This means that the bladder muscle is overactive and contracts when the bladder is not full and is then responsible for the daytime accidents. First, we will give you some tips and advice in this video, as well as in the leaflet which is provided, to see if we can improve the situation. You will then get afterwards a telephonic consultation from one of our specialist doctors to see if it has improved the symptoms. First of all, it is important that you make sure your child goes to the toilet on a regular basis. They need to go for a wee about every 2 to 3 hours during the day. Make sure that your child empties their bladder fully. So teach them to do double voiding, which will help them emptying. When your child thinks it has finished, you can make them stand up for a second and then try again. It is very important that you make your child drink during the daytime. Otherwise, the bladder doesn't learn to stretch and achieve a larger capacity. They need to drink at least 6 to 8 cups of watery drinks, and also make sure they have drinks during the time they spend at school. Constipation needs to be avoided, and that is of course important by maintaining a very good diet and adequate fluid intake. Because you can understand that when the bowel is full of poo, it will push against the bladder, which results in less capacity of the bladder, so more likely to have accidents. Also avoid too much fizzy and caffeine holding drinks like tea, coffee and chocolate, as they can stimulate the bladder. What is important is to remember that if your child is quite stressed or emotional due to an important event in their life, like a new baby, moving house, or perhaps even getting bullied at school, they can start having problems of wetting during the day and nighttime again. It is important that you ask your child if there is anything wrong if this would be the case. There is a group of children, mainly girls, who have accidents only when they laugh, cough, sneeze, or jumping on the trampoline. This is what we call stress incontinent, and it is not covered in the video. Also, when children have urinary tract infections, they can have episodes of daytime enuresis, and when their infection is treated, this will normally stop. This would be associated though with other symptoms, and I'm thinking about like temperature, abdominal pain, or even smelly urine. Now, this group is not the one we will concentrate on. It are the children who are developing a bladder instability, as I explained before. Now, if you're not sure if your child has true accidents, which they can't control, it's worthwhile doing a trial to see if with regular micturition and perhaps even a reward scheme like star charts on the fridge can improve the symptoms. You will then get a follow-up phone call from our specialist doctors. It is quite important to try to follow the conservative tips which we mentioned. We would also like to ask you before the phone call to fill in a flow volume chart which is provided in this package. We would like you to record the amount of urine they produce in an old jug and record it on the chart in milliliters, so that we get an idea how much urine your child is passing. Also record when they have actually accidents in the day and the night time. We would like you to do this for approximately 10 to 14 days, as we then will have a good idea if, with the conservative advice we have given, this improves during that application. At that stage, when you have all the information together, we will give you a telephone consultation to discuss if you've seen any improvement with the measures we have advised you to take. If this is the case, we will then organize an ultrasound of the bladder with a picture before and after passing urine, so that we have all the results available when you will be seen after that in clinic to decide if further treatment is required. You probably at that stage will get a trial of medication, which we call anticholinergic medication, to see if we can help the bladder relax and improve your child's symptoms. And it's always possible that you will require more investigations at a later stage.